So when I was going through medical school, there wasn't very many opportunities to interact with the underserved or to learn about caring for the underserved. It was very sporadic, and for some students, they didn't get it at all. And so I really wanted more of that when I was a student. And so when I became a resident and then later as a faculty member, it was really important for me to try to make some changes in the medical school so that students would have more opportunities to work with the underserved. I pursued a grant that allowed me to have time really to work on developing a curriculum for homeless healthcare for the medical school, and then things just kind of snowballed. And my ultimate dream was to have a clinic, and I thought it would take a long time to establish that, but everything happened sort of within a year. And there was just a lot of support from the students and the faculty, and I think everybody realized that it was something that was going to be good for the school and good for the community. So that's how Home Project was born.
HOME stands for Homeless Outreach and Medical Education, and that's exactly what we do. Number one priority is providing medical services to those who are houseless, both sheltered and unsheltered. And our secondary, almost equal priority is educating our students to be compassionate and well-rounded healers and providers.
At Home Clinic, they really are the doctor. And so, the patients view them as the physician, not just the student in training, and they get a lot more autonomy. They're always supervised by attending physicians. So, we're making sure that they're doing what they need to do, but they really take ownership of the patients at the clinic, and they feel like they're the doctors, and they're learning how to feel more comfortable with this type of patient population, which they might not get in their other rotations.
While many of our patients actually do have insurance and may have primary care, they might not feel comfortable going to the clinics, either because they've encountered stigma or people have not been very nice to them in the past. I'd say a great majority of our patients tell us, "Thank you for being so kind. Thank you for listening to me." And so we hope that we can form a relationship with the healthcare system that can persist beyond Home Clinic, so they can see maybe the medical establishment isn't so bad, and we can help be a bridge back to a primary care system. We're really not intending to take over. We don't want to take over for the primary care systems that are in place, but perhaps we can help with mending some of the relationships that may have been broken in the past.
Home Project officially has 9 sites, although 2 of our sites right now are still closed because of COVID. But we do go to 7 other sites across Oahu. So we go to Chinatown, we go to the Post site at Ke'ehi Lagoon, we go down to Haleiwa, we have a clinic at the St. Augustine's Church in Waikiki. We go out to Kailailoa and Waianae, and then also Waimanalo. So it spans all over the island. They all have kind of different patient populations. So, at some of the shelters, we see more families, and we're taking care of a lot of the more chronic problems like diabetes and hypertension, and then helping the kids to get their school physicals and vaccinations that they might not, be getting otherwise. Versus some of the patients that we see that are more kind of street houseless, they have a lot more wounds, and so we're doing a lot of wound care for them and really trying to establish trust in the medical system. We see a lot more mental health issues in that population as well, so trying to connect them with behavioral health services. And then of course, just kind of dealing with emergencies, that come up, people having asthma attacks or having chest pain, or we've had a couple patients that have like skin growths that turn out to be skin cancer, and just being able to provide a safety net for them that they feel like they can't get anywhere else.
As much as I hope we're able to make an impact on our patients' lives, I think just as much our patients impact our students and our physicians. Interacting with our patients and getting to know their stories helps us to remember that every patient comes with a story to tell, whether we're seeing them at home clinic or in any other setting. They're experiencing a number of struggles that they may not be ready to open up to in the clinical setting. And I think it teaches our students to be patient. I hope it teaches them to be kind. And I hope that the lessons that they learn at home clinic regarding compassion, empowerment, and advocacy are life lessons that they'll take with them regardless of the population they hope to serve in the future.
For our, hopes for Home Project, I think that we would always like to be able to expand because there's definitely areas that we don't go to, people asking us, for help. And we just have a limited capacity, so we're sort of limited by the number of students we have, but more so actually by the number of supervising physicians we have. So we're always looking for physicians to donate their time to help supervise our students. And we'd also like to be able to provide more comprehensive care as well. And so, I think that we do a really good job in terms of the medical side of things, but I'd really like to see us beef up our social services for our patients. And it would be wonderful if we could hire a social worker or have a psychologist on staff with us. Now that Home Project has been around for around 15 years, we have had many students come through our program, and now we have all of these alumni who worked in Home Project as students, and some of them even as volunteers and then students. And now they're practicing physicians, and they're the ones that are coming back and volunteering their time to work with our patients and mentor our new students. And that is really special for me to see. And it just really, I think it brings everything full circle, because when I first started Home Project, that's really what I wanted, was for more people to be exposed to both homeless healthcare but underserved care in general, and then to want to incorporate that into their practice, whether it was with their regular practice or just volunteering here and there. And so it really is quite special to see so many of our students wanting to give back. Over the years of Home Project, it really blows my mind, because when I first sort of envisioned what it would be, it is so much more than that. And it has grown. When I think back to when we were just kind of this pop-up clinic, we literally were a tent with shower curtains around it at the Next Step Shelter, and to what we are now with a mobile medical van and tons of students interested and helping. We have a waiting list of volunteers that want to work with us. And just the numbers of people that we have interacted with and impacted. It just really, it really is why I went into medicine. And I think that I was missing that for the beginning part of my career. And I just feel so privileged that I am in a job that it's basically my dream job, being able to work with this population and to influence future physicians in a way that will make a positive impact, not just for their lives, but for the community in general. I think that's just so special. So I'd just like to say a huge thank you to all of our volunteers, both present and past, and our medical students, and all of our wonderful volunteer physicians that come out to work with Home Project. You guys are really the heart of what Home Project is, and our patients love you, and I love you, and I'm just really thankful that you are all a part of the Home Project Ohana.